This video is super important for all people that are just starting chiropractic care and wanting to live a pain-free life. If you watch it to the end and follow the recommendations that I give you, I promise you'll save money, you'll feel better, it'll reduce your risk of future arthritis, and you will get healthier. When I was a young child, I remember being terrified one day when I went into the bathroom and I saw a set of false teeth in a glass jar on the counter. You see, my mom wasn't taught how to take care of her teeth properly when she was a child. The technology that her dentist used way back then was to just remove the teeth. So she gradually had most of her teeth removed, and now she has false ones. She didn't learn how to brush and floss in order to preserve the health of her teeth. Now she must live with the consequences of her past. Our spine is similar to our teeth in that we must live with the consequences of our past. The problem is that we can't get a false spine. So I want to talk with you about how to keep your spine in a healthy place and keep it from rotting. This is not only just a pain or arthritis issue, it is a brain function issue. The research shows that every joint in your body must go through full range of motion every 24 hours, or scar tissue and adhesions will form that lead to arthritis and degeneration. The problem is that once the adhesions have been there for 2 weeks, the change can be permanent. In addition to causing arthritis for your future, lack of full mobility will actually interfere with your brain function. Dr. John Rady, the author of Spark, said that if your body is not moving, your brain has no reason to live. Roger Sperry, Nobel Prize winner in 1981, went even further and showed how important movement in the spine is when he said, "The movement of the spine is analogous to the movement of a windmill producing power for a power plant." In other words, your body, and more specifically your spine, must move freely or your brain can't do its job, and you'll age prematurely and not fully live when you get old. Let me explain how this works. When the joints of the body move, there's a stimulus called proprioception that sends an impulse up to the cerebellum of your brain. Your cerebellum is responsible for all of your autonomic nervous system activity, meaning your heart beating, your lungs breathing, your digestion and hormone balances, and every other thing that happens without you consciously thinking about it. So when the joints of the body move, proprioception is stimulated. This proprioception is what makes your cerebellum do its job. In short, your cerebellum is responsible for about 70% of your brain's function. It's kind of a big deal. And it's able to do its job because movement occurs in the joints of your body. 70% of the proprioception stimulus, the stimulus that makes your cerebellum work, comes from movement in the neck. 20% comes from movement in your spine lower than your neck, and 10% comes from the movement of all your other joints. So if you were to prioritize the importance of joint motion and keeping your brain working, you better put a lot of focus on your neck. So what happens if the joints don't move fully? Instead of proprioception being stimulated, something called nociception is stimulated. Nociception also goes to your cerebellum, but it signals that there's a potential problem. It will cause something called sensory motor neural integration error, which basically means that there's a garbage message coming into the cerebellum because of the abnormal joint motion. And therefore it causes a garbage impulse going out to the muscles and to the tissues in that area. This will cause misfiring. This is one reason why muscle spasms occur. This is also one reason why many organs begin to malfunction. This is also why you can get physical therapy or massage therapy, which I'm in favor of both, but it will not cause lasting change because those modalities by themselves do not significantly break up the adhesions that will allow you to have full joint motion. Another downside to nociception is that if there's a lot of it, meaning the joint is really restricted or inflamed, often can be due to a deficiency of certain essential nutrients, and sometimes because of a poor diet in general, the nociceptive impulses go beyond the cerebellum and they reach the cortex, and this will give you the emotion of pain. In other words, you will always have sensory motor neural integration error causing health problems first before you will ever experience pain. Proprioception and nociception kind of act like they are on a balance scale. If proprioception is high, then nociception will be low. This means your cerebellum will be healthy and your body will be responding well to the stressors you put it under. But if your nociception is higher than your proprioception, then you not only will be in pain, but you're heading down a very bad path. If you watch the backpack analogy video, this is called allostasis. So a major key to getting out of pain is having high proprioception. In order to have high proprioception, you need to have as close to full range of motion in every joint in your body as possible, particularly your neck and your back. How do you accomplish that? The first key is to have your spine checked by a chiropractor. If you have joints that have a buildup of scar tissue, moving your spine on your own will not break up the scar tissue enough and restore proper motion. You may need the help of a chiropractor to get things moving. Remember, you may not be in pain, but if you have low proprioception, your cerebellum is not functioning properly, and a chiropractor may be the first step in restoring that motion that will help you get out of pain. The next step is to do your part every day in moving each joint in your body, especially your spine. Remember, every joint in your body must go through full range of motion every 24 hours, or scar tissue and adhesions will form that will turn into arthritis. How do you do this? Spinal hygiene. Spinal hygiene is specific movements that you must do on your own in order to move the joints and to stimulate proprioception. On our website, we have several videos that show you different ways that you can create the movement that you need to stimulate your proprioception. Your chiropractor should suggest the best things for you to do based on the findings of your spinal health assessment. So let me sum everything up. Full range of motion to your spine, especially your neck, is critical to your health. When you move the joints in your body, you stimulate proprioception. When your joints don't move, it stimulates nociception. Proprioception is positive, nociception is negative. If you get really good at moving your spine every day, then you'll minimize and maybe even stop the progression of arthritis. But more importantly, your cerebellum will be healthy. If we go back to the analogy of dentistry, if you brush and floss every day, you will have healthier teeth. If you see a chiropractor regularly, do daily spinal hygiene, and take vitamin D3 and liquid fish oil daily, you will have a healthier spine and you'll live with less pain. Be sure to check out a video we made called Do This One Test to see if you need a chiropractor. That video shows you how you can measure how well your cerebellum is functioning as a result of your proprioception. Now that you know how important it is for your spine to move freely, wouldn't you agree that you should share this video with the people that you care about? I encourage you to share this video on Facebook or however you share your videos so that you can help somebody else. You really could change their life.